Okay, everybody, so here is the video for chapter 26. This is our final topic of the semester, and it's probably also going to be our shortest PowerPoint. We've actually talked quite a bit about some of these diseases already, so some of this will be a little bit of a review. So we already know that any part of the body that's exposed to the external environment is a potential portal of entry. And of course, the urinary and reproductive systems are exposed to the external environment and therefore can have issues. So for the urinary system, we're talking about infections of the kidneys, the bladder, and the urethra. For the reproductive system, we're talking about sexually transmitted diseases. We've already had the discussion about technically they should be called sexually transmitted infections because you can only transmit an infection. You can't transmit a disease. So it's very important for all of you to understand STI versus STD. Someone in the medical field may say STI, whereas a patient is most likely not going to understand STI, and you would want to use the term STD so that the patient isn't confused. So again, technically it should be called a sexually transmitted infection, but most people still just know the term STD. And urine should actually always be a sterile fluid. So if if the doctor thinks that you have a urinary tract infection and they take a sample of your urine and there's a lot of bacteria, that's a surefire way of knowing that you have a UTI because there is not supposed to be any bacteria in the urine at all. And then we will discuss just very briefly about the normal microbiota that's associated with the female genitalia, just as we talked about the normal microbiota of the skin and the large intestine. Okay, so cystitis is inflammation of the bladder, and this is most likely caused by E. coli. So what can happen with this is you can get a urinary tract infection due to poor hygiene practices. And it's much more common in women than in men because of the way that the anatomy looks. But essentially, if you go to the bathroom and you wipe back to front instead of front to back, you can actually get some small fecal material or fecal particles that come into contact with the opening to the urethra. So what can happen is the E. coli in your feces can actually make its way to your urethra, and then from your urethra it can actually travel to your bladder and cause a urinary tract infection. So that's the most common way that people get a UTI. Oftentimes the E. coli from their digestive tract or their fecal material gets to the urethral opening, and then that can cause the infection. Sometimes cystitis can be caused by a staph infection that can make its way up the urethra, but it's much more common to be E. coli. And then another thing that can happen is a urinary tract infection due to a hospital stay. So this would be another example of a nosocomial infection due to the use of urinary catheters. So you can imagine if you're constantly having to get a urinary catheter put in or replaced, you're going to have that exposure. Even if it's a brand new sterile urinary catheter and all the precautions are taken to maintain sterility, there's still definitely a possibility that you could get a UTI from a urinary catheter. And then pyelonephritis is actually inflammation of the kidney, and this is most often caused by untreated cystitis. So if you have a urinary tract infection, it ends up causing cystitis, and that nothing gets done about that, it can actually travel to the kidney, which is much, much more dangerous. This is why it is so crucial, it is so important to have a urinary tract infection taken care of, usually through the use of antibiotics, because you do not want a urinary tract infection to just kind of be left to its own devices, because it can cause a very serious infection of the kidney that can become life-threatening. And then another important bacteria to talk about when we talk about urinary tract infections is leptospirosis. Leptospirosis is caused by Leptospira interrogans. It is a spirochete, so it is kind of in that same family as Lyme disease and syphilis. It is a zoonotic disease, so this is a disease that you can get from dogs and cats. It's most commonly spread in the urine. So if you come into contact with dog or cat urine, so if you work at a vet or you have lots of pets, if you get the urine on your hand and then it somehow gets into you, it can actually cause very serious kidney or liver disease, and eventual kidney and liver failure. The symptoms of leptospirosis start off as flu-like symptoms that progress to kidney and or liver issues. So this is why it's so important, and this kind of goes without saying, if you get animal urine on your hands or anywhere else, you need to wash, you need to clean up. You don't want to have that animal urine sticking around, because leptospirosis is one of the major diseases that can be spread that way. Okay, so bacterial STDs, or reproductive diseases, and again, the more technical term is STI, not STD. Gonorrhea is caused by Neisseria gonorrhea. It causes painful urination and pus discharge from the penis in males, but it is most often asymptomatic in females, because the urinary tract and reproductive tract in females are separated. So it's usually asymptomatic, and it is therefore much, much more dangerous in women, because they can have gonorrhea and not know it. Chlamydia is very similar to gonorrhea. It's caused by a different organism, Chlamydia trachomatis, which we've talked about before. The symptoms are very similar to gonorrhea. Sometimes you can have an infection with both gonorrhea and chlamydia, and they are both often asymptomatic in women and therefore much more dangerous. So pelvic inflammatory disease, or PID, this is what can happen in women if they have gonorrhea and or chlamydia and it goes untreated, unnoticed. It can get much, much more serious. It can lead to things like ectopic pregnancies, infertility, possibly even cervical cancer. So this is why, if you're a female and you're sexually active, it's very important to go to your doctor regularly, get tested for all these things, because you're most likely not going to know that you have it, because they are often asymptomatic in women. And then finally, syphilis, which we talked about a little bit before when we talked about Lyme disease. It's caused by Treponema pallidum, which again is a spirochete, a special little group of bacteria. Primary stage is the rash, or a canker sore, which is painless. It doesn't burn, it doesn't itch, it doesn't hurt, so it often goes unnoticed. Secondary stage can be mild fever, flu-like symptoms. Latency period can be anywhere from 2 to 4 years, maybe even longer. Tertiary stage will include weakening of the heart, neurological symptoms, and certainly there is treatment available. The same type of antibiotics that are used with Lyme disease, which is doxycycline, that can be helpful in treating syphilis, but it does not cure it. Once you have syphilis, you have it forever, just like Lyme disease, but it is very, very treatable with antibiotics. Viral STDs, we've talked about herpes before, so herpes simplex virus 2, burning lesions followed by painful, highly infectious vesicles. Recurrence is very common as the virus is sporadically reactivated. There is no cure, there is no vaccine, but that is a major area of disease research and development right now. Genital warts, we've talked about human papillomavirus before, or HPV. This is the virus that is linked to cervical cancer, so it is an oncogenic virus. There is, of course, no cure, but there is a vaccine for HPV. And then finally, we talked a whole lot about HIV and AIDS already. So, of course, the HIV virus is what causes AIDS. It is considered to be an STD because it is transmitted through sexual contact, but of course it does not infect the reproductive system. It goes after the helper T cells. And of course, we talked a lot about HIV and AIDS already. Okay, so vaginitis is inflammation of the vagina, and it's commonly caused by one of three different organisms. One is a fungus, one is a protozoan, and one is a bacteria. So Candida albicans is a fungus that causes a yeast infection of the vagina. Trichomonas vaginalis is a protozoan that causes trichomoniasis. And Gardnerella vaginalis is a bacteria that often will not cause vaginitis. It causes something called vaginosis, which is an infection without inflammation. The bacterial form of this disease is usually caused by a change in the normal microbiota, which is mostly made up of lactobacillus. So lactobacillus is the good bacteria that live within the vagina, and if there is a change due to use of antibiotics or use of certain soaps or detergents, that kind of stuff, that can actually kill off the lactobacillus. And when the lactobacillus is gone, that's when the Gardnerella can kind of move in and cause an infection. Sometimes, again, the infection does not include inflammation, but sometimes it does. So you certainly want to know these three different organisms. So you want to know, the name of the organism, which one's a fungus, which one's a protozoan, which one's a bacteria, and of course all three of them are linked to vaginitis or vaginosis. And that's it for chapter 26. I told you this will be a really short topic. And again, a lot of the STDs we've kind of talked about in other ways. So some of this is even a little bit of a review. So hopefully this small amount of material won't be too much of an issue to remember for the last test.